So this video will go over the upper appendages. Okay, so begin with the clavicle. Make sure you're able to tell right clavicle from left clavicle. And the way you're able to tell is first you have to determine is this to orient yourself, right? Okay, so tell superior view from inferior view. Okay, you'll notice the conoid tubercle is located more inferiorly and it points backwards. Okay, so it's more toward the back than to the front. Okay, and this curvature here has to be more medial. Okay, you can also tell what's medial and lateral by looking at the ends. This is the sternal end. This is the acromial end. The acromial end is flatter, shaped kind of like a spoon. And the concave side of the spoon should be facing downward. So, in other words, on the same side as the conoid tubercle. Conoid because it's like a cone. Okay. So because the sternum has to be here, and this is the anterior view, okay, that tells you this is the left clavicle. We've gone over those landmarks already, so we're going to move on to looking at the scapula. So now, how do you tell right from left scapula? Well, first, figure out, are you looking at it from anterior side or posterior side? Okay, so the spine of the scapula or scapular spine is located on the back, just like your entire body's spine is located on the back. Okay, so this is the front view. This is the front view. You have to then imagine this glenoid cavity, okay, with the humerus inserted. So if the humerus is this side, sticking out like this, that means this is the medial border. So this makes this the left scapula. Okay. Another way you can tell is these processes, the coracoid process and the acromion, should point outward, point laterally. So this is lateral, this is medial. So this is the left scapula. Okay. Again, this is the coracoid process, shaped like a beak, raven beak. This is the acromion. Scapular spine. This is the infraspinous fossa, supraspinous fossa. Okay. Glenoid cavity. Supraglenoid tubercle. Infraglenoid tubercle. Right here. Okay. This is the superior border. This is superior angle. This is the suprascapular notch. This is the medial border or vertebral border. This is the lateral border or axillary border. This is the inferior angle. Now moving on to the humerus. How to tell right from left? Well, the most notable landmark that allows you to tell left from right is this, the olecranon fossa. This is where the ulna articulates with. Okay, so that's on the back, so that tells you this is the front. If this is the front and the head of humerus is right here, that means the glenoid cavity has to be here, so the body has to be here. That tells you this is the left humerus. Okay. Now in terms of landmarks, this is the head. Under that, that's the anatomical neck right here. The surgical neck is right here. Surgical neck is more commonly fractured than the anatomical neck. Okay. On the side, you'll notice the two bumps. This is the greater tubercle. This is the lesser tubercle. The groove in between is the intertubercular sulcus. Intertubercular sulcus, also known as bicipital groove. Okay. Okay. Now, if you look on the back, okay, so this is the back. Okay, so this is the back view. Okay, so this is the head of the humerus. So this is medial. Look on the lateral side instead. You'll notice a bump. Okay, and that will be your deltoid tuberosity. Whoops, sorry, we crossed that out apparently. Okay. But you should know the radial groove. Maybe I can point it out by showing it to you here. I think it will be more obvious. Okay, that's it. Oh, sorry. That's a radial groove. Okay. Now the lateral epicondyle, well, once you figure out what's front, what's back, you can easily figure out what's medial, what's lateral. Okay, so if it inserts into your shoulder like this, then this is left. Right, so that makes this medial, this is lateral. Okay, so this is the lateral epicondyle, medial epicondyle. This will be the medial supracondylar ridge, lateral supracondylar ridge. Okay, and this here is more medial, okay, compared to this. So this is the trochlea. This is the capitulum. The trochlea articulates with ulna, whereas the capitulum articulates with the radius. This here, this fossa, is the coronoid fossa, shaped like a crown. Okay. If you turn this around, this is the olecranon fossa. Moving on to radius. So you notice the radius is more lateral relative to your ulna. Okay. Okay, now how to tell right from left. Well, you see this bump here. You don't really have to know what this landmark is called, but this tells you that this is posterior view. The more concave side, so the side with the depression, this is the anterior view. So if this is the anterior view, okay, so now you know what's front, what's back. Okay, now you have to tell what's medial, what's lateral. Well, if you look into here, I'm not very good at rotating this on my computer. Okay, so this is, do you see this notch? This is the ulnar notch. So this is the ulnar notch of the radius. This allows the radius to articulate with ulna. Okay, and you should know that the ulna is more medial relative to the radius. Right? Just imagine your body in the anatomical position. It's more medial, right? So the ulna is more medial. This is the ulna notch. Then your body is right here, making this the left radius. Okay. This pointing distal tip, this is the stylar process of the radius. Up here we have the radial neck. Sorry, this is the neck, this is the head. Okay, and this, of course, is the radial tuberosity. Now let's take a look at the ulna. First thing we have to do is to determine whether this is right ulna or left ulna. Well, in order for you to differentiate between the two, you have to first determine, are you looking at the bone from the front or from the back? Okay, so when you feel the back of your elbow, this is what you're feeling. This is the olecranon, or olecranon process. This trochlear notch is facing forward, so this is the front view. Now you have to locate the radial notch, which allows the ulna to articulate with the radius. So this ulnar notch, along with the trochlear notch, is what allows me to determine, is this the right or the left ulna? Okay, so now you have to imagine, okay, if this is the radial notch, that means the radius is here. And since radius is more lateral, right? So that means the body has to be here, right? Because this is medial. Medial meaning it's closer to the body's midline. So the body is right here, making this the right ulna. I hope that makes sense. Okay, so next, trochlear notch, coronary process. This is the coronary process. Okay, so this is the coronary process. Radial notch. Distally, you have the styloid process. Okay. And the ulnar tuberosity, right there. Okay. Moving on to carpal bones. Okay. So this is how you count the carpal bones. Remember that there are 8 of them. You can use the mnemonic we talked about in lab. Some levers, try positions that they can handle, and this is the order they go in. So from proximal to distal. You count the proximal 1, 2, 3, 4, starting from the same side as your thumb. So this is the first digit. So you're starting from this side. 1, 2, 3, 4, okay, 5, 6, 7, 8. So after you finish the first row, then you go to the second row. Some lovers try positions that they can't handle. You can, use other mnemonics if you like. Okay, so that means this is the scaphoid. This is the lunate. Okay, this is the triquetrum. Okay, and this one floating here, this is the pisiform. Okay, and the second row begins with the trapezium, trapezoid, capitate, and a hamate. So notice there is a hook on the hamate. The scaphoid is the most common carpal bone to fracture. Okay. Now the metacarpals can be numbered 1 through 5. Metacarpal 1. So this is the first metacarpal of the right hand. Second metacarpal, third, fourth, fifth. And then on your digits, your fingers, okay, digit 2 through 5 have 3 segments: the proximal, the middle, and the distal phalanges. Whereas your thumb, the first digit, just has proximal versus distal. Okay, so this will be the first distal phalanx of the right hand. This one will be the third middle phalanx of the right hand, etc. Okay, so this concludes our video.